Autonomic nervous system, effectors. Now we get to talk a lot about all these different things that happen throughout the body that will be able to be doing something. We're not just going to look at things, we're going to look at action today. The autonomic nervous system is a large cohort that's controlling a number of aspects of the body. What we have here are two different columns. These are spinal cord columns. The first one is the autonomic nervous system's sympathetic component, and then on the other side we have the parasympathetic component. The sympathetic component you know because it has paraventricular chain ganglia on both sides of the spinal cord. These will act as relay spots and sometimes where the soma or cell body of the nerve will be. The parasympathetic nervous system, remember, primarily comes from cranial nerve number 10. So this vagus nerve will innervate many of the different organs of the body. These are the same organs that will be innervated by those particular sympathetic fibers that come off of the spinal cord. In the parasympathetic nervous system, then you also have the splanchnic nerve and some that come from the sacral area, and they will innervate things like the bottom portion of the GI tract, places like the bladder and the reproductive organs. So when we go through this process, I think it's best to do these one organ at a time. And so we'll do one organ, the next organ, and keep going through those. We'll talk about what's the function that's involved, as well as what receptors will mediate that particular function. Let's start off with the heart. The heart is going to be innervated by both the sympathetic and parasympathetic nervous system. The SA node, and this is again the area that's going to control heart rate, if it's engaged by the sympathetic nervous system, it's through beta-1 adrenergic receptors, and this will increase heart rate. In contrast, the parasympathetic nervous system is mediated through muscarinic receptors, and that decreases heart rate. The conduction system of the heart, especially around the AV node, velocity can change in response to sympathetic and parasympathetic stimulation. Beta-adrenergic receptors here also increase conduction velocities in the sympathetic nervous system, while muscarinic receptors, these decrease the conduction velocity. In terms of contractility, which is the contraction, the strength of the heart, this is going to be mediated also by beta-adrenergic receptors, but now this increases contractility or inotropy. Muscarinic effects don't really have anything to do with the ventricles to push blood around to the body or to the lungs. What happens to the blood flow that goes to the skin and the muscle? Here we need to talk through which things cause constrictions and dilations. So in the skin, we mainly have alpha adrenergic receptors that cause vasoconstriction. So vasoconstriction is going to be decreasing the luminal diameter of a blood vessel. That reduces the amount of blood flow. Beta-2 adrenergic receptors are located in skeletal muscle, and they can cause a vasodilation. That said, they are usually not engaged in normal physiology. You have to give a supraphysiological dose of a drug to get these receptors to be enacted. So normally, our response is having a vasoconstriction in response to the blood vessels of skeletal muscle. So you vasoconstrict them in terms of the sympathetic nervous system response. Hopefully, you've looked now on the parasympathetic side and notice there is no innervation of blood vessels to the skin or to the muscle from the parasympathetic nervous system. That said, there are some relaxing factors that can be released, and some of these have been associated with some parasympathetic innervation, especially in the facial region. The autonomic nervous system and the lung. So what changes happen with the lung in regards to the sympathetic and parasympathetic nervous system? The main component with the lung are the bronchioles. If you dilate a bronchiole, what you'll get is an increase in the diameter. And if you have an increase in diameter, you'll have a reduction in the resistance and therefore more flow. And the sympathetic nervous system does just that by dilating bronchioles. It does that through beta-adrenergic receptors. The opposite response is a constriction, and this is mediated by the parasympathetic nervous system through muscarinic receptors. What about the GI tract? How does the autonomic nervous system, both the sympathetic and parasympathetic, mediate this? We have to throw one caveat into this before we go through the table, and that is, remember, there is another division of the autonomic nervous system, which is known as the enteric nervous system. The enteric nervous system gets information from the sympathetic and the parasympathetic, but it also operates on its own. So we'll have to throw that caveat in as we go through this particular table. So what are the effects on smooth muscle walls? The sympathetic nervous system relaxes them. The parasympathetic nervous system contracts them. So what does that mean practically? If you have a smooth muscle wall relaxation, you're going to slow down the food as it travels through the GI tract. If you have a contraction, it will speed it up. So as you speed up food that travels through the GI tract. So this affects gastric motility. If you want to think about this in terms of the sphincters, now these are the areas of the gastrointestinal tract that act as gates. You'll get a sympathetic nervous system will cause a vasoconstriction, a constriction, and what this does is prevent the foodstuff from going through that particular gate. The parasympathetic nervous system relaxes those gates so that food will move through the GI system. In terms of secretions, it's kind of interesting, but both the sympathetic and parasympathetic nervous system increase salivary secretions. They do it by a little different mechanisms, though. The beta-adrenergic increase from the sympathetic nervous system creates a more mucousy saliva. And the parasympathetic nervous system secretes more of a watery saliva. And so these are differences that can happen in salivary secretion, but both tend to increase it. It's just what type, watery or serous solutions or more mucousy solutions. In terms of stomach secretions, the parasympathetic nervous system increases gastric secretions. Also, pancreatic secretions is the parasympathetic nervous system, again mediated by muscarinic receptors. The sympathetic nervous system doesn't have anything to do with the secretion end, only with the motility end for the GI tract. What about the bladder? The autonomic nervous system also engages the bladder so that if you have urinary contents, you need to know, is it appropriate time or not to void that bladder? The bladder. What we're going to do here is cause either a relaxation or a contraction. Remember, if you're relaxing the bladder, you are not then wanting to have that urge to void. If you're contracting it, this is a time where you may want to then, if it's socially appropriate, to void your bladder. The sphincters are also involved in that same kind of maneuver. There will be a constriction portion and a relaxation portion. Now again, this is the autonomic sphincter. There's also a voluntary or skeletal muscle component that you control from your cortex. So this is just the one part of being able to avoid the bladder, but not the voluntary component. What about the reproductive organs? The autonomic nervous system, both the sympathetic and parasympathetic nervous system, innervate the reproductive organs for both males and females. If you think about for the male genitalia, the sympathetic nervous system has to do with ejaculation. The parasympathetic nervous system has to do with erection or increasing blood flow. In terms of the female genitalia, it's very similar. Uterine contractions are a sympathetically mediated event, while increasing the secretions and increasing the amount of blood flow is a parasympathetic nervous system. This is one of the organ systems that I think should be most highlighted because there is a dual activation that needs to happen. So in this case, you need to have both an increase in blood flow and ejaculation to happen. So they are working together in concert rather than working in opposition to each other. So a lot of the different organ systems, we saw that one constricted and one dilated, and so they seem to be opposites. But in the reproductive organs, they can work in concert to do a function. The eye is also innervated by the sympathetic and parasympathetic nervous systems. This is an important process in being able to get more light into the eye when you need to see more, or protect it when you need to see less. The eye. Sympathetic and parasympathetic innervation both affect the eye. The sympathetic nervous system affects radial muscles, and this will dilate the pupil so you get more light in. And as you do this, this increases via alpha-adrenergic receptors. The opposite is a pupil constriction. This constriction is mediated by muscarinic receptors from the parasympathetic nervous system. Finally, as you think about ciliary muscles, there can be dilation that occurs from the sympathetic nervous system and constriction for the parasympathetic nervous system. So as you can see here, the dilation seems to be more sympathetically mediated and the constriction and contractions more parasympathetically nervous mediated. Now let's address some of the skin-specific components. We already talked about blood vessels in a previous one, but now we're going to go through and talk about the skin appendages. And you might ask, appendages? I don't have anything growing off my skin. Maybe you do. Sweat glands are called skin appendages because they are part of the glandular structure, but they will end up being a structure of their own. They are mediated by the sympathetic nervous system and muscarinic receptors. Wait. I said muscarinic receptors. Did you mean it? Yes, I did. This is a rare time when the sympathetic nervous system is using a muscarinic receptor. Typically, these are for the parasympathetic nervous system, right? Correct. But in this case, this is an exception to the rule where you use acetylcholine as the primary neurotransmitter and bind to muscarinic receptors, and it's still under sympathetic control. The other type of skin appendage is hair. And so hair is sticking off the skin. You can modulate the hair, though, by contracting piloary muscles. These pilomotor muscles allow for hair to stand up. And this would be in a time when you're very cold or if you're nervous and your hair starts standing up. And this also can make little kind of piloary bumps, or we like to call goosebumps. These are mediated by alpha-adrenergic receptors, and this is contraction of that smooth muscle. You notice that the parasympathetic nervous system here doesn't activate skin appendages. Let's now move on to tear glands. So lacrimal glands are innervated by the parasympathetic nervous system, and muscarinic receptors increase their secretions. The liver is important in being able to do a lot of different functions for the body. In this case, it is going to be innervated by the sympathetic nervous system. It is going to be involved in gluconeogenesis, which is the production of new glucose. It is also involved in glycogenolysis, and that is the breakdown of glycogen. Both of these two things will do increasing blood glucose. Either gluconeogenesis, making new glucose, or breaking down glycogen into glucose. The liver then can release it so the rest of the body can utilize it. Adipose tissue is innervated by the autonomic nervous system. You wouldn't necessarily think of this, would you? Why would fat be innervated by the autonomic nervous system? But there are a couple times from sympathetic events that it makes it important. Let's go through those. Adipose tissue has beta-3 adrenergic receptors. These receptors, if engaged by epinephrine or norepinephrine, cause lipolysis. Lipolysis is the breakdown of fat. Then what you would do is the adipose tissues will release free fatty acids into the blood. Another tissue that's also adipose tissue is called brown adipose tissue. Brown adipose tissue, especially in the infant, is important for thermal regulation. They utilize these same beta-3 adrenergic receptors and end up causing heat production. So both white fat and brown fat are innervated by the sympathetic nervous system. The kidney is innervated by the sympathetic nervous system, and it does this to help regulate things like blood flow and glomerular filtration rate. The other thing that it does is stimulate the release of renin. And remember, renin was such an important molecule in starting the renin-angiotensin-aldosterone system. The RAS system allows you to reabsorb sodium and water, and this is an important process that is mediated by beta-1 adrenergic receptors.